Next affected area is the hip joint. After the stroke, patient will not have the power or have decreased power of the hip flexion, due to which patient have the tendency to fall down. To prevent this, we need to encourage the patient to learn the sit to stand transfers. To perform this, the attendant need to lock the foot from the front side and the back side to prevent the slip of the foot while standing. Next, we lock the knee of the patient. Then, we ask the patient to stand and sit. We need to keep this lock on the foot as well as on the knee throughout the movement. This transfer need to be repeated 10 to 15 times. Next exercise to improve hip flexion is stamping or assisted hip flexion. For this, patient can support the thigh from the non-affected hand and the attendant can hold the calf for the assistance. The attendant can give the target above the knee. The patient is supposed to touch the target from the knee, and this exercise needs to be repeated for 10 to 15 times. There are few exercises which we can do in the supine lying position to improve the hip flexion. One exercise is straight leg raises, that is SLR. For this, the attendant will support the calf and give the patient the target to touch and touch the ball again, touch the hand and touch the ball again to improve the hip flexion. This exercise needs to be repeated for 10 to 15 times. Next exercise is assisted abduction and adduction. The attendant is supposed to support the calf of the patient and ask the patient to take the leg away from the midline and towards the midline, away and towards the midline, again and again. This exercise needs to be repeated for 10 to 15 times.